9%, and Egypt, Libya, each with 4%. During this past week, 41 of our countries have reported a case fatality rate that is higher than the global average of 1.1%. So the majority of our countries are still reporting a case fatality rate that is higher than the global average. Two countries, Somalia and Sudan, the same two, are reporting a case fatality rate that is higher than 5%. During this past week, no additional countries are reporting experiencing a fifth or a sixth wave. When we look at the variants of concern, again, the situation has not changed on the continent in terms of the variants that are being reported, but one additional country is reporting, that is Somalia, is reporting Omicron, the sublineage B11529. But in terms of overall variants, there are no new variants to report on the continent. When we look at the 1 week trend analysis, today we are reporting on Epi Week 31, which is the 1st to the 7th of August. And we are comparing with Epi Week 30, which was 25th to the 31st of July. During this 1 week analysis, a total of 14,044 new cases were reported in Africa. This is a 31% decrease when compared to Epi Week 30. The highest proportions of the new cases were actually reported from the Northern Africa region with 57%, Central Africa region with 12%, Western Africa region also with 12%, Southern Africa region with 10%, Eastern Africa region with 9% of those new cases during Epi Week 31. When we look in detail at those 14,000 new cases, the following countries had the highest numbers of cases. That is Tunisia with 4,581, Morocco with 1,644, Burundi with 1,487, Libya with 808, and Algeria with 800. When we look at the highest daily incidence per million population, the following 5 countries had the highest numbers. Seychelles with 616 per million population, Libya 16, Burundi 17, Cabo Verde 13, and the Gambia 9 cases per million population per day. During Epi Week 31, a total of 99 new deaths were reported in Africa, which is a 40% decrease from the previous week. When we look at the 4-week trend analysis, and this is the Epi Week starting from, the period starting from 11th of July to the 7th of August, this is the situation in Africa. We document an overall 28% average decrease in new cases over this 4-week period. And by regional breakdown, we see that there was an 18% increase in the Central Africa region, 31% decrease for region, for Southern Africa region, 7% decrease for Eastern Africa region, and 4% decrease for Western Africa region. When we look at the breakdown by the most populous countries during this period, Nigeria documented a 4% average increase, Kenya 36% average decrease, Ethiopia 28% average decrease, South Africa 19% average decrease, DRC 13% average decrease, and Egypt there was no change. During the same period, there was an overall 16% average decrease in the number of new deaths that were reported on the continent, broken down as following by region. 21% increase in the Western Africa region during these 4 weeks, 6% average increase in the Eastern Africa region, 24% decrease in the Southern Africa region, 13% decrease in the Central Africa region, and 9% decrease in the Northern Africa region during this 4-week period. When we look at it by the most populous countries over the 4-week period, we see Nigeria with a 75% average decrease, Ethiopia 43% average decrease, South Africa 30% decrease, DRC 25% decrease, Kenya 19% decrease, and Egypt there was no change. Let's move to the testing situation on the continent. To date, 120,185,169 COVID-19 tests have been conducted in Africa since the pandemic started. Over 550,000 new tests were reported during this EP week 31, that is 1 to 7 August 2022. This represents a 37% increase when compared to the previous week when we documented 402,019 tests. For this same EP week, we saw the positivity rate being 3%, while the test per case ratio was 39%. This represents 73% decrease in the positivity rate, while giving a 99% increase in the test per case ratio when compared to the previous period. 2 countries are reporting a test positivity rate that is higher than 12% during this week, and that is Libya and Tunisia. For COVID-19 vaccine, as of the 10th of August 2022, the situation in Africa is as follows. 925 million COVID-19 vaccine doses have been made available in Africa to 54 member states. Those doses that have been administered to date is 653 million, which gives 71% of the total supply that has been made available to Africa has been administered. The coverage of the total population for those who are fully vaccinated is now at 21.1% for Africa. The same 10 countries are still, as given last week, are still holding the top 10 positions, and that is Seychelles at 81.3%, Mauritius at 76.6%, Rwanda at 76.5%, and this is an increase from last week. Morocco at 61.9%, it is an increase from last week. Botswana 61.7%, again an increase from last week. Cabo Verde at 55.2%, Tunisia 52.8%, Sao Tome and Principe at 44.5%, another increase from last week. Liberia at 44.1%, and Mozambique at 44%. When we look at the deliverables through the AVAT mechanism, as of 7th of August, we had delivered 74,033,500 doses of vaccines across 35 Africa Union member states. When we break this down, we see that 48.7 million were purchased by the member states themselves and came through the AVAT mechanism. 17.9 million were purchased through the Saving Lives and Livelihoods program, supported by the MasterCard Foundation, and 7.3 million were donations from the US government that came through the VAT mechanism. In the last 1 week, we have supplied an additional 151,200 doses of the Johnson to Namibia. Having looked at the situation of COVID-19 on the continent, I would now like to give you an update of the other outbreaks that are significant and we are following here on the continent. I'll give you 5 today. Monkeypox in many countries, Rift Valley fever in Uganda, Lassa fever, cholera, and measles, again, in multiple countries. For monkeypox, as of the 10th of August, we had documented 31,800 cases across 89 countries globally. And when we look at the African continent, we see that cumulatively from the beginning of this year, we have documented 2,947 cases in 11 African countries, with a case fatality rate of 3.5%, having reported 104 deaths during this period. When we look at the period since the last briefing, we have documented 136 new cases and 1 new death from the DRC and Nigeria. The new death was from Nigeria. The DRC during this period has reported 56 new cases and no deaths, while Nigeria has reported 24 new cases confirmed, 56 suspected, and 1 new death. Since the beginning of the year, a total of 417 samples have been analyzed, of which 157 were positive for monkeypox, giving us a test positivity of 38%, and only the West African clade has been reported in Nigeria so far. Last week, we did, there may be some monkeypox vaccination that are going on in the DRC. The correct situation is that there is currently clinical trials that are going on in the DRC for a vaccine that is under emergency use authorization called Jenios, and it is not monkeypox vaccination that is going on in the DRC. To date, there are no vaccines that we have received as Africa for monkeypox, though we continue to engage with relevant institutions and our partners across the world to try and get monkeypox vaccines here to the continent. As Africa CDC, to support our member states, we have continued to build the capacity of the different countries for laboratory diagnosis and surveillance so that the index of suspicion is high. We are also organizing clinical management capacity building sessions, which will improve the way in which our clinicians handle monkeypox cases when they are documented or identified. The second outbreak on the continent is Rift Valley fever, which at the moment, thankfully, is only in Uganda. And the outbreak has been confirmed through laboratory diagnosis. 2 confirmed cases have been identified, and 1 death has been reported, giving a case fatality rate of 50%. We are working very closely with the Ugandan ministries of health and those of agriculture in the affected areas so as to provide the support that is required for Rift Valley fever in Uganda. In preparation, however, we are also supporting the surrounding countries so that we are able to quickly identify if at all a case is also seen within the neighboring countries. The third today is Lassa fever, which has affected several countries, particularly in the western side of Africa. To date, we have entered in 7 countries on the continent, with the total number of deaths of 186, giving us a case fatality rate of 2.7%. Since the last briefing, additional 107 new cases have been documented, and unfortunately 2 new deaths have also been reported from Liberia. Nigeria has reported 100 suspected cases from within the country, while Liberia has reported 2 new confirmed cases of Lassa fever, and unfortunately the 2 new deaths have also been reported from Liberia. As Africa CDC, we continue to work with the countries that are affected. At the moment, we have 7 countries that are affected, and we continue to provide them with support to ensure that we are working to minimize the risk of spread of Lassa fever from areas where the outbreak is occurring, which are areas where it is endemic. The 4th outbreak we are dealing with is the multi-country cholera outbreak. Since the last briefing, we have documented 481 new cases and 12 new deaths, giving us a case fatality rate of 2.7% for this period. And the cases have been from Cameroon, Malawi, and South Sudan. Both and have occurred in these 3. From the beginning of the year, we have documented 33,000, unfortunately lost 484, giving us a case fatality rate of about just over 1.5%. Finally is the measles outbreak. Since the last briefing, 107 new cases have been reported with no new deaths. And the new cases have been reported from Cameroon and the Central African Republic. Cumulatively, from the beginning of the year, we have seen 162,782 cases and 1,500 deaths, which gives us just around 1% case fatality rate, and 23 countries have been affected. We are working with these countries to ensure that spread is minimized, and as appropriate, vaccination and case management is handled in a proper way to reduce chances of further spread. So Wayne, this is what we had for our journalists today, and happy to take questions. Back to you.
Thank you very, very much, Ahmed, for that comprehensive breakdown. And I see already colleagues have started putting their hands up. But before I call upon you to ask your questions, let me just send out that WhatsApp number again. It is +251 94 550 2310. That is +251 94 550 2310. So today, let's start by going online and calling upon Ashley Furlong, who has a hand up. Ashley, perhaps just start by telling us your news agency, and then go ahead and ask your question. Hello, Ashley. Ashley?
Hello, can you hear me?
To ask a question? Yes, please. Just tell us your news agency and then go ahead.
Wonderful. I'm from Politico Europe. My question is about the availability of monkeypox vaccines. Could you provide any more detail on those negotiations? And has the vaccine manufacturer, Bavarian Nordic, said that they don't have stock available? Just any more information about the difficulties in accessing those monkeypox doses? Thank you very much.
And thank you very much, Ashley. And we can't give too many details when we have not reached an agreement, and these are the rules of negotiations. What we can tell you is that there are very advanced discussions with at least two of our partners, and we are really looking forward to, at some point, being able to give you some good news. But at this stage, we are not able to give you details of names, and this we'll only be able to give at the end of the discussions, depending on how the results have come through. Thank you.
Thank you very much, Ahmed. Colleagues, you can also send in your questions through the question and answer section, as well as through the WhatsApp number that I gave earlier. Promit, please tell us your news agency and then ask your question.
Hi, am I audible?
Yes, we can hear you very well.
Okay, thank you, Wine, and thank you, Dr. Ahmed, for taking up the time. As usual, every week we get to hear from you. My question, I'm from Reuters in South Africa, Johannesburg. My question is actually on Aspen. Around 2 weeks back, Dr. Ahmed, you had said that you are in detailed discussions with a lot of potential buyers for Aspen's own branded vaccine, the Aspinovax. So I wanted to understand, what is the current status on that? And is there some kind of a timeline that you can share with us?
No, thank you, Promit. Discussions still continue. Timelines are very difficult to give because we don't control the feedback responses that we get from those that we are discussing with. But those discussions do continue. We are quite hopeful that we will be able to get some positive result out of the negotiations that are continuing. We are very hopeful for that. But unfortunately, we can't give you timelines at this time.
All right. Thank you very much. I don't see any questions coming through. Perhaps to give our colleagues time, a minute or so to formulate their questions. Perhaps, Ahmed, if there's, just hold on, let me see. Promit's hand is still up. Promit, do you have a follow-up question?
Yes, can I ask one more question, please?
Yes, please.
Okay, Dr. Ahmed, also wanted to ask you that, considering the amount of, the vaccination rate of for COVID that is going on in Africa, what kind of stock of vaccines do you currently have? And in terms of the pipeline, how much do you expect that kind of a stock can meet the demand for the next few months? If you can give some clarity on that.
No, thanks. The situation is very different from one country to another. Good news is we push for mass vaccination that we've been holding across the continent through our Saving Lives and Livelihoods initiative. We are getting countries asking for more vaccines because the stocks within those countries are running low. Vaccination is not as high, then we still have stock, and we still have the countries keeping stock within their own jurisdiction. So the situation is very mixed. The countries where vaccination rate is increasing, they're asking for more. The countries where vaccination rates are still relatively slow, those are not yet asking. So giving a global Africa-wide picture will be quite complex because it may send the wrong message. But the message I would like you to have is that we are pushing for mass vaccination, and where we are pushing for mass vaccination, we are seeing new uptake of more vaccines by those particular countries. So we are very encouraged by that sign. And we know that as we roll out in many more countries, we are going to have even more requests for additional vaccines. And those who have asked for additional vaccines, we are working with them to ensure that we make those vaccines available in good time so as not to slow down the mass vaccination campaign that we are supporting. Thank you.
Dorcas Wangira, who is with the BBC, has a series of questions. So perhaps I'll give them to you one at a time. So the first is South Africa from the end of this month due to a lack of orders. What will this mean for the continent's hopes of production if there is no demand? So that's the first question. We'll come back with question 2 and later.
Thank you, Dorcas. As I'd said earlier, when I think it was a Promit who had asked the question, I think that first question is answered. But we as Africa CDC, the Africa Union, we do not want to see a situation where Aspen closes any of their manufacturing capacity to COVID-19 vaccines. It would not augur well for the continent that when we are building our capacity for local production, we don't have all those who are supposed to be purchasing vaccines for the continent and beyond, not purchasing from African manufacturers. This is something that we want to avoid, and we are doing everything we can to ensure that it is avoided. We want every manufacturing facility on the continent that is manufacturing any health product, particularly vaccines in this situation, to have buyers coming to buy. And the vaccines being used on the continent, we prefer that they come from Africa first before we purchase anything from outside of the continent. This was the position of our heads of state since at the beginning of the year, and we are trying our very best to implement that. So any closure will not be good for the continent, will not be good for health security globally.
Thank you. Esther Nakazi, freelance reporter based in Uganda, says, do we have medication for monkeypox in Africa, and how widely available is it to African countries?
Thanks, Esther. We have moderate availability of treatment for monkeypox, and we continue to work with affected member states to expand availability of specific medication for monkeypox. But we continue to, across Africa, we continue to provide supportive treatment to those who are affected in the event that specific medication for monkeypox is not available in that particular country or that particular facility. We continue to work to ensure that it is more available, more readily available, not only to where the cases have been reported, but generally in Africa, just in case we get spread anywhere on the continent. That's the current situation, Esther.
Cara Anna from Associated Press says, when you say you are in advanced discussions with partners about the monkeypox vaccines, are you referring to national governments, companies, or to health organizations?
Thanks, Cara. It is largely multilateral institutions and non-African governments. We have not yet opened up discussions with the private sector because all the doses that are currently either being manufactured or have been made available have been bought by individual countries. So our discussions at the moment are with non-African countries and multilateral institutions.
We come back now to Dorcas Wangira and on to her second question, where she says, kindly give more details on the clinical trials in the DRC. When did they start? That's one of the question. Then she goes on to say also, what is the Africa CDC's perspective on Tonix Pharmaceuticals' planned clinical trials for a monkeypox vaccine in Kenya?
That was Dorcas, I think. And thank you, Dorcas. When we talked of clinical trials that are going on in the DRC, we were specifically referring to a phase 3 clinical trial for Imvamune, which is traded as a Janios. This particular molecule has emergency use authorization from the US FDA, but at the same time needs to go through the full spectrum before a vaccine can be able to be made available to market. And that is why the phase 3 clinical trials is being done in one province in the DRC. When a drug has achieved emergency use authorization, or it has been approved for clinical trials, we are very supportive of that as Africa CDC. Indeed, we are also supportive of clinical trials being done here on the continent, because the need for Africa to participate in development of vaccines is one of our priorities. So we support clinical trials to be done here on the continent, and we are also we are encouraging developers of therapeutics and vaccines to come to Africa, and in an organized and controlled way, we do the clinical trials here in Africa as well. And it is those that exist currently, whether in DRC or Kenya, or those that are being planned. We encourage that they come, and we work with them on the continent to expand clinical trials for more products to be made available for these priority pathogens that are affecting the continent.
Okay, we are going into Dorcas's last question, but before I give it to you, I just want to remind colleagues that this is the last question that we have right now. And if colleagues have any more questions, please feel free to send them through to that WhatsApp number +251 94 550 2310. Either that, or to come online, or to send in your question through the question and answer section. All right, let's go on to Dorcas's last question, where she says, how many African countries so far have launched the Saving Lives and Saving Livelihoods initiative?
No, thank you, Dorcas. At the moment, actively launched are Ethiopia, Kenya, Rwanda, Nigeria, and Namibia. Those are 5 countries, and very much in the pipeline are another 4 or so. So we are very encouraged by the fact that we are having these rapid launches. At the moment, active launches have been done in 5 countries, and at least 3-4 more are at a very advanced stage of being launched in the coming days.
Okay, thank you, Ahmed. We don't have any more questions coming through, so I think it's time for us to wrap up with just an overview of the key points that you want colleagues to take away today.
No, thank you very much, Wayne, and thank you very much, colleagues who have joined us today. I would like to pass 3 messages today. One is the need for us to aim for the 70% vaccination for COVID-19. We are very much on the ground launching mass vaccination campaigns across the continent so as to ensure that we are getting as close as possible to the 70% mark. So let's support that vaccination rollout for COVID-19 across the continent. Second is as we continue negotiations with various entities for purchasing more COVID-19 vaccines from African manufacturers, as we continue negotiations for getting more manufacturers to come, vaccines manufacturers to come to Africa and establish their facilities. Second message that I really would like to come through very clearly is that all this is only going to be valuable if multilateral organizations, our bilateral partners are actually purchasing vaccines from our African manufacturers. Our heads of states have called for a minimum of 30% of our needs here on the continent being purchased from local manufacturers. And we encourage that this message also passes through, that you cannot be able to have local manufacturing unless you've created the opportunity for those vaccines to be able to be purchased. And thirdly is around monkeypox, that the numbers seem to be inching up a little. What is key is that, one, we still don't have vaccines, although we are engaging with those we are hopeful are going to be able to do some sharing of the vaccines. We still don't have vaccines, and we don't have enough diagnostics as well. So most of the cases that we are reporting are actually suspect cases based on clinical diagnosis and not laboratory confirmation. And so those two very important tools, that is diagnostics and vaccines, need to be made available after the WHO Director General already declared monkeypox public health emergency of international concern. So these are the three takeaway messages, Wayne, that I would like our colleagues to go away with today. Thank you.
Thank you very much, Ahmed. That was Dr. Ahmed Ogwell, who is the Acting Director of the Africa Centers for Disease Control and Prevention, which is an institution of the African Union. Colleagues, I want to thank you for joining us during 30 or so minutes, and for your continued interest in engaging on the issues of public health on the continent. Let me also thank those behind the scenes, my colleagues from the African Union, who facilitate this broadcast for us. But for now, I think it is time for us to say bye-bye, and let's meet again next week on Thursday, 12 noon East African time. Bye-bye for now.
Thank you.